In this video, you'll learn how these medications are classified, how they work, who they are best for, and how to use them safely and effectively. Diabetes drugs differ in how they work, how long they last, and how they're taken. Understanding these differences helps doctors personalize treatment for each patient. Let's now take a closer look at the 5 main drug types and what makes each one unique. The first group includes insulin sensitizers. These medications help your body use insulin more effectively. The most common one is metformin. It works by reducing how much sugar your liver produces. Metformin is usually the first treatment recommended for type 2 diabetes, especially for people with overweight. It doesn't cause weight gain and has a low risk of causing low blood sugar. However, it's not suitable for people with advanced kidney disease. Another drug in this group is pioglitazone, which improves insulin action in muscle and fat, but it may lead to weight gain and fluid retention. Next are medications that increase insulin release. These are called Insulin Secretagogues. They include sulfonylureas such as glipizide and also glinides. These drugs tell your pancreas to release more insulin. They are most effective for people whose pancreas still works well but can cause low blood sugar, especially in older adults. We then have medications that work through the Incretin system. This includes SGLT-2 receptor agonists like semaglutide and DPP-4 inhibitors. SGLT-2 drugs slow digestion, reduce hunger, and help your body release insulin when needed. They are helpful for people with heart disease or those who want to lose weight. These drugs may be taken weekly by injection or daily as pills. DPP-4 inhibitors are oral medications that also help regulate insulin but with a milder effect. They have fewer side effects and are easy to tolerate. Another group is the SGLT-2 inhibitors. These medications help the kidneys remove sugar through urine. One example is empagliflozin, which can eliminate about 70 grams of glucose per day. SGLT-2 inhibitors are especially helpful for people with heart failure or kidney disease. They may cause side effects such as genital infections or dehydration, so monitoring is important. Finally, there is insulin itself. This is essential for people with type 1 diabetes and often needed in later stages of type 2. There are 3 main types of insulin. Long-acting insulin helps manage fasting glucose levels. Rapid-acting insulin is used before meals. Premixed insulin combines both for convenience. Insulin requires careful blood sugar monitoring to avoid dangerous lows. But knowing the types of drugs isn't enough. How we use them also matters. One core principle is personalizing your treatment. Different drugs are better suited for different people. If someone has heart failure or kidney disease, SGLT-2 inhibitors are usually a good option. If weight loss is a priority, GLP-1 receptor agonists are often the preferred choice. For people with reduced kidney function, the doses of metformin or sulfonylureas may need to be adjusted carefully. Another important point is never changing your medication plan on your own. Taking an extra dose of sulfonylurea can lead to serious low blood sugar. Insulin adjustments should always be based on several days of glucose readings and done with your doctor's advice. Monitoring is also essential. For example, if you start an SGLT-2 inhibitor, watch for signs of dehydration or unusual fatigue. If you are using GLP-1 medications and develop severe stomach pain, speak with your doctor immediately. Tracking how your body responds helps you and your care team make better decisions. In summary, diabetes medications are powerful tools when used correctly. Understanding how they work and which ones match your health needs is essential for long-term success. Always follow your doctor's advice, keep track of your blood sugar, and don't be afraid to ask questions. With the right support and knowledge, you can take control of your blood sugar and protect your long-term health.